Hello, this is Dr. Dell. This video is on alphabetic list of problems, still on letter F. Today I'm going to talk about functional pain. So this is it's another, if you recall, I have talked about the functional illness, which is not no pathological changes, couldn't find any organic conditions. So this is called functional pain. It's similar to, it's probably one of the functional diseases which is presented as the pain. But it's functional pain, it's not associated with any pathological changes like arthritis or any disease caused, like, for example, the headache is not a migraine, it's not any kind of tension headache, is not related to the pathological conditions, but the pain is real without objective findings. So this is a group of disease called functional pain. The pain could be anywhere, like headache or the muscle, the joint, and a typical example of this probably mimic the condition of fibromyalgia, but this functional pain syndrome can occur in all the age groups, all the genders, male or female. Like fibromyalgia, majority cases are in the young or middle-aged of female, and with the association of sleep, deprived sleep, or depressed, or some other psychological conditions, but there was no diagnosis of those kind of diseases. So this functional pain, it is a pain. It is, I call it, the pain is real, but without real objective findings, which means the laboratory exam is normal, and including the X-ray for the joint, it couldn't find any inflammation, or the blood test for the for inflammation factors like the CRP, C-reactive proteins, or the sediment rate, erythrocyte sediment rate, they are all normal. So indicating there is no organic diseases, but the pain is real. So this is associated with any other, some of the other conditions, like for example, I just mentioned the fibromyalgia or the irritable bowel syndrome. There's no organic cause for this diarrhea intermittently with constipation, but it is there without finding of the digestive system abnormalities, like no ulcer, no inflammation, no gastritis, no inflammation for the colons or small intestines, and no polyps, nothing, but just this and no infection. Look at the stool of this kind of diarrhea, there's no abnormalities, but it's just the imbalance of the autonomic nervous system. So this is the homeostasis is disturbed, but it's not by the pathological finding, pathological process. So this is hard to understand, hard to explain, but it is a disease called functional pain. So what kind, is there any emergency situation related to the functional pain? I don't think so, really not, because first of all, the pain is chronic. Secondly, there's no organic disease warrant the emergency visit, but just the aching pain, generalized, could be from head to toe. The difference between this functional pain and fibromyalgia, or there's a functional somatic disease syndrome, functional somatic syndrome. These are they are all different. Functional somatic syndrome belong to the psychological realm of disease. It is a disease, but the somatic transformation of the non-objective findings into the condition. One symptom, for example, a lot of people present not pain but dizzy, for example, dizziness or pain of course, non-chest pain, non-cardiac chest pain, or including fibromyalgia, similar situations. So this is a wide realm of disease. Actually, this video is really here to explain in the medical standpoint. So when you have this kind of condition, you see a physician, you think it's your joint is feel pain, for example, and your physician look at the joint through the x-ray, through the exam, through blood test, but you're not diagnosed as the arthritis. So this video is trying to give you explanation. There is a functional pain disease. It's a disease, but doesn't have to belong to arthritis, doesn't have to belong to the inflammation or anything, but it's just a group of disease. So the purpose for this video is when you had this kind of problems like a headache, you want to see a physician. It's not diagnosed as a migraine, it's not diagnosed as a tension headache or any kind of rebounding headache, none of them, but just one of the organic pain, one of the functional pain disease. So you do not feel like seeking another, you can seeking a second opinion or something, but there is a group of disease called functional pain is existing. In terms of management, any of the analgesics like the pain medication is probably not that helpful in this group of pain. However, if the pain is very severe and can receive some kind of analgesic medication, but usually can treat it with anti-inflammatory or antidepressant or psychological medications or lifestyle modification. For example, improve the sleeping, healthy diet, losing weight, again back to the fundamental lifestyle modifications, and also to exercise, to limit the sense of stress. So these are all, this is the strategies in terms of treat the functional pain disease. It is a disease, as I said, but just not diagnosed as the arthritis, migraine, or the back pain. Is different. It's the back pain usually has the findings, either the overweight or the muscle strains or the chronic pain syndrome. But this is it's called functional pain. It is there. It is real, but just no any organic or pathological findings. So so if you have this kind of problem, for example, the pain just bothers you, the aching pain bothers you, it doesn't have to be migratory or just located in one place, but just see your physician to check it out, to exclude any inflammations or any arthritis or any migraine, headache, etc., and diagnose as a functional pain and treat it accordingly to improve your life quality and to improve your feelings. So this is about the video called functional pain, and I hope it helps to give you some idea to comfort and also to believe your physician if you have the pain but not diagnosed as arthritis, not diagnosed as the migraine, etc. Just the functional pain. So okay, I'm going to stop here and thank you for watching. I will see you next time.